Hello and welcome. You're watching FYI. I'm Sonal Mehrotra Kapoor. Now, the pandemic, COVID-19, has resulted in a health crisis, destroying healthcare infrastructure, even economies worldwide. Now, one of the biggest challenges of our fight against this virus has not just been the human loss, but the cost of the treatment, which has taken a toll on finances, even mental well-being of different sections of society, especially the poor and the middle class. So on FYI today, we are discussing financing healthcare and the lessons we have learned from COVID so far. Now, just to give you a brief background into this, now more and more people are starting to consider health insurance plan as essential as other necessities for survival. And it's getting reflected in numbers as well. In a country where insurance penetration stood below 4% pre-COVID times, that percentage has now shot up multifold. But there is still so much that really needs to be done over here. To understand that, we've got an excellent panel coming up for you. But before we get into that, let's also give you some statistics behind this. We try to look at doing an analysis of the current healthcare insurance cover, and that tells you that the current health insurance cover in the country stands at 35%. And did you know that about 25% of India's population earning over 5 lakh do not have any health insurance? One major reason is said to be the majority of policies who do not cover OPD expenses. OPD expenses, again, accounting for about 45% of the total healthcare expenses. Also, there is low government spending when it comes to health. That's been talked about so much. It's just about 1% of the GDP. That number needs to really go up and become a priority now. For this now, CII has called for a health insurance for all citizens by 2025. And they've got some key recommendations as well. And there they talk about how consolidation of government spending by centre and state for funds needs to take place. There needs to be co-funding basis on the ability of people to pay the principal, employee deductions, diversion of the ESI, informal sector as well. These are some of the recommendations they are giving. Also, on top of that, saying that healthcare provision to be governed by hospitals accreditation system as well. Some suggesting that sort of the mutual fund campaign model needs to be adopted in this case as well. So those are some of the issues that we will look at first up in this special broadcast that we have for you of CII and NDTV getting together in this very important conversation. Let me introduce my panel. On that note, we've got with us Dr. Naresh Trihan, Chairman, CII Healthcare Council and Chairman and Managing Director for Medanta Medicity as well. Thank you so much for your time, Dr. Trihan, being back with us on FYI. We've got Krishnan Ramachandran joining us. He's a Chairman, CII Task Force on Health Insurance and the Managing Director and Chief Executive Officer at Max Bupa Insurance Company Limited. We've also got Dr. S. Prakash with us, Member, CII Task Force for Health Insurance and Managing Director at the Star Health and Allied Insurance, and also with us Tapan Sangal. He's the Chairman, CII National Committee on Insurance and Pensions and the Managing Director and CEO of Bajaj Allianz General Insurance Company. We couldn't have asked for a better panel to actually be talking about this very pertinent issue. Let me start by giving the first word to Dr. Trihan. Dr. Trihan, there has been a paradigm shift in the country on how we look at health at the moment. Post-pandemic, it has changed our ways of thinking. But how much of that do you see translating into health cover?
You know, for a long time, we have been discussing the entire sector in India, how to make that stack where every citizen that stands on the earth of India is actually given good coverage for their healthcare. Mm-hmm. Now, there are several situations which you have to keep in mind. One, the size of our population, the economic strata of our own population, mm-hmm. and how to provide quality healthcare, which we all know, starting from primary healthcare, which is the most efficient way of providing healthcare at the least cost, maximum amount of impact in prevention, in hygiene, in health practices, nutrition, all those things. So that's one part of the stack.
Right.
The other part of the stack is, unfortunately, somebody gets sick. What avenues do they have open for themselves to be able to access healthcare? So it's starting from the concept of Ayushman at the village level, where you talk about wellness centers, and then you build a stack on the primary health center, the community health center, the district hospital. This is the government system. And then they have tertiary care also. On the other hand, you have the private sector, which is mainly providing secondary and tertiary care and quaternary care. So what happens is that it is a clear demarcation that primary health care costs X amount, and when it comes to secondary, tertiary and quaternary care, which everybody deserves, is an other cost basis. So first, on one hand, we must realize what is the unit cost of delivering a particular service to anybody who deserves that treatment. That's one part. Then you say, what are the enablers of being able to access it? And truly, insurance is one of the biggest instruments around the world, where in different forms of insurance, like you take the NHS in UK, you take Medicare in America, there are many other countries, but also know the fact that in spite of all the money that they spend on it, they still are not perfect yet. So given the challenge, what can we do in India? So Ayushman was one fact. Some of the other insurances like CGHS, ECHS are the other. Private insurance for people who can afford it is another. And there's another thing I would like to introduce here. And that is what is Health India Saving Plan. That Health India Saving Plan is much like your PF, your Provident Fund. That each person is allowed, according to their earnings or their tax structure, X amount to be put into a health plan for themselves. It is with a agency or with banks or wherever, but this has only access to when you need healthcare. And if you don't, for your lifetime, luckily you didn't need any of that money. When you withdraw it, you pay tax at that time.
Interesting what you're saying. But again, the challenge here, I understand, would be how to make it pan-India, how to make it accessible for all. I mean, there are so many Indias in this one India that we live in, right? On that note, let me bring in Mr. Krishnan here. Mr. Krishnan, what are some of the few sort of macro level things you think India needs to do now to try and improve its healthcare cover?
Well, thank you, Sonal. It's a pleasure to be on this panel, and I fully endorse what Dr. Trehan said in terms of some of his suggestions. And to specifically respond to your question, Sonal, I think if anything, COVID has taught us that health is the most important asset by far that we have as India, and without healthy Indians, none of the ambitions that we have or aspirations that we have as a country, can truly be fulfilled, right? So to take off from what Dr. Trehan said, if the premise is every Indian has to have access to quality healthcare, there are two parts to it, right? One is how do we deliver it, and what's the delivery infrastructure around it? And clearly, COVID has exposed a lot of the gaps that we have, even in the large cities of the country. And the second is how do we finance it? And on the finance part of it, clearly CII has a very well thought through set of recommendations in terms of how do we make sure that health insurance is available to all Indians by 2025. And really there are two parts to it, right? One is what the state takes care of. And when I say state, I mean both the central government as well as the state government. And there's a plethora of, a whole bunch of schemes that we have today in the country. And I think there is a strong case to consolidate it, combine the ESI, CGHS, Ayushman and various state government schemes, consolidate that financing, and that should hopefully address maybe 500, 600 million Indians where the state directly pays for insurance. The second part is again what Dr. Trehan alluded to is, for the rest of the population, private health insurance is the answer. And there really what can the state and private sector do to incentivize, subsidize, nudge, make aware, but essentially pull all stops to make sure that every Indian, either funded by state or through private means has health insurance by 2025. And I
True.
think that is very much achievable, provided we all agree that this is the way forward and we put our efforts around it.
Right.
Now, in doing this, I think there are 4 or 5 elements that we need to address to make sure that, as we do this, we don't make the system more expensive, and we continue to keep in mind that whatever we do, it has to be affordable to the common man, right?
Absolutely.
And there I have 4 or 5 concrete recommendations. One is, look, we do need standards and regulations across the entire industry, whether that's insurance or healthcare delivery, hospitals, primary care, secondary care, tertiary care. We do need standards and regulations that apply across the entire ecosystem. Second is to make sure that this does not become more expensive. I do believe we need payment systems reform. Pay for value, pay for outcomes, whatever you want to call it. I think we need to move towards that. We need a higher level of price transparency, low variability across the entire system. We need technology. To what Dr. Trehan said, we need more money getting into primary care,
all
and maybe private sector.
Very important points over there, Mr. Krishna. I'm only sort of interrupting here because there's limited time. I am told there's some callers.
No. So
there are some callers as well.
Yeah,
but before I get into that, I just want to take in an opening comment from Mr. Tapan as well to try and understand then what have been your biggest learnings, if I can point out, then from COVID. Like I said, there has been a paradigm shift. People are looking at healthcare, but there are reservations, mostly when it comes to paperwork and the rest of it, mostly when it comes to getting it cleared at the hospital level. So what can you give us as solutions today?
Two things, Sonal. First and foremost, I would like to thank NDTV for this initiative. Well, my strong belief is, it is not that there are not systems in place. It's also a question of awareness. Let me give you a small example. So when COVID struck, our regulator came out with the simple COVID covers, Corona Raksha, Corona Kavach. The cost of it is about 607 rupees as premium for a cover, let's say about 2 lakh to 2.5 or 3 lakh rupees. Now, if you look at the Indian, and I can see the analysis being put up by NDTV on the site, if you look at the Indian coverages, about 30-40 crores covered by the government. And if I look at the ones who have bought insurance, that will be 12 to 13 crores. But 75 crore Indians who can afford 600 rupees a year are not covered. Now, to buy this policy, it's just 2 clicks. No underwriting, any website of any insurance company, you can just go, buy it, and Corona can happen to anybody. Nobody can say that I'm completely secure. I don't require an insurance cover. So technically, the servers of insurance companies should have been crashing, because for a product which is just 600 rupees a year, and 70 crores Indian who can afford that, and
but
Corona,
can I say, I don't think getting an insurance is becoming a problem. That the access is increasing. It's the claims end that people still have.
That's what coming to Sonal. It's an interesting point. Now, if I look at the insurance cover, actually, in the month of April last year, the insurance growth was -%. So first awareness at that level that one should have a cover. It's available, have it. That's the first point. The second point, if you look at the claims also, if I look at the industry, I'm proud of the Indian industry, insurance industry. 24,000 crore, is the claim on Corona, which is there with the insurance industry.
Wow.
Across the world, Sonal, I don't remember any country in which people have provided COVID cover when COVID hit. People withdrew COVID cover. Indian insurance industry stood by Indians.
That's absolutely true.
They
and I'm very glad you brought it up.
Yes.
I'm very glad you've brought it up because my next caller has a question related to that, I'm told. Please go ahead with your question. All right, I'm told Vivek is joining us on Skype. Vivek, thanks so much for speaking with FYI. Go ahead with your question, please.
Okay. My wife was infected with COVID in the month of April and May. So we got cashless claim from the hospital. But when we requested insurance company to settle a pre-hospitalization claim, they bombarded us with so many of queries when the hospitalization was done on the basis of the report, on the basis of investigation, why insurance companies are making so much of fuss on clearing the pre-hospitalization bills and all. Okay. That's my question.
Okay, Dr. Prakash, who's double hatting on the program, also talking about insurance and has huge experience of all these years looking at these things. How do you answer? Because what Vivek is saying actually echoes with so many more.
Yeah, Sonal, you're right. Actually, the customer is common to both insurers and doctors in the hospital. And unfortunately, we look forward to a synergy, but unfortunately, there is a separation more than synergy. Ideally, both of us should understand the requirements. A denial for admission for COVID-19 by insurance comes if there is no proper documentation about the need for admission. And if the admission criteria is not fulfilling the All India Institute of Medical Science or ICMR guidelines, meaning that if the patient is having a mild disease, only 2-3 days of illness, and all the inflammatory mediators are normal, CT scan is normal, just RT-PCR is positive, otherwise saturation is well maintained, and all other vital parameters are normal, we wanted the bed to be reserved for the deserving patient.
Yeah.
So that is the reason why sometimes insurance we deny for mild cases.
Right. Vivek, does that answer your question?
No, that doesn't answer my question. My question was, my wife was hospitalized on the basis of HRCT done, and hospital gave approval for cashless claim during her hospitalization. But after her discharge, we requested insurance company to settle our pre-hospitalization claims, even after giving them all bills, reports and everything.
Right.
And it was already written on the HRCT report that it's recommended by emergency department of the hospital.
Got it. Dr. Prakash, not to get into a specific case now, we understand there is a grievance redressal system as well, but you know, more on so many others who are looking at these queries. How do you answer this sort of distrust, if I can call it that, in the system?
Yeah, Sonal, I will take just 30 seconds.
Okay.
In general, HRCT is not the determining factor for admitting a patient. It is oxygen saturation, the respiratory rate and the pulse rate, other parameters which are more vital. Okay, if the patient is young, no comorbidity, just by looking at HRCT, we have to treat the patient, not the images. So if there is a disparity, always we can talk to the treating doctor, we can get it sorted out, and insurance can come forward and pay, because from the insurance desk, we cannot really determine the clinical status. I understand there are limitations, but overall, let us follow guidelines in areas where it has been recently mentioned, like, you know, where there is a small differences, we can always talk to the treating doctor and sort out.
Okay. All right. There is so much more that I think needs to be discussed on this issue, but I'm completely out of time. Gentlemen, we'll perhaps come back to you for more on this. We're going to slip into a break, but Dr. Trehan stays with us for a special show on vaccine coming up next. Welcome back. It's time for a special campaign, Vaccinate India, in partnership with Google, where we're discussing questions that you might often have about the vaccine. Joining us back on the program is Dr. Naresh Trehan. Dr. Trehan, I just want to start by asking you something that is running on everybody's mind right now, which is the question on effectiveness of the vaccine. We are talking in a times where not just Delta and Beta Gamma, but a Delta Plus variant being discussed now, and so much inquiry about whether the vaccines will work, not work. How are you seeing this?
So let me give you a little bit of data. So we did a study at Medanta where we have 6,000 employees in our Gurugram facility. 4,000 of them accepted the vaccine and 22,000 of them did not. Being in a hospital, working in a hospital, they still had vaccine hesitancy.
I see.
So if you compared 400 of each group, the ones who had 2 doses of vaccine, only 5% of them got a reinfection, in spite of the fact that they were working in the COVID environment intensely. But none of them, except one, needed to be admitted to the hospital. So that means all of them had got a very mild infection. One of them was in the hospital for 3 days for another infection, not for the COVID part. And they went home in 3 days. So that tells you one story, that the vaccine is effective in preventing serious disease, at least the way it existed in the second wave.
Right.
Those who got one jab, there were 400 in that group also, but there was no time for the second jab. Out of those, double the amount, about 10-12% got infected. But again, only 3-4% of them had to be admitted. The rest were recovered at home.
That makes it crystal
Again,
clear.
very mild.
Right.
But then there was 20% of the ones who were not vaccinated, who did get infected, and a full 10% of them had to be hospitalized. So the story it tells you is vaccine is effective in preventing serious infection and even death.
Right.
So all over, this is the story that must go through, because vaccine is needed, should be used. Everybody should get it when they get a chance.
Yeah. And your thoughts on the Delta Plus, which is just coming in post all the vaccines being out in the market already?
So that's something to worry about, because we know that this virus has been acting much more notoriously than the previous ones that we have experienced in our lifetime. So point is, when the mutation takes place to another point where it may develop certain changes in its structure and protein, that it becomes resistant to the vaccines, we don't know really. So far, the impression is that it is still effective to a large degree against any variants that exist, including the Delta variant.
Sure.
But the Delta variant spreads much easier and is more virulent. So we need to worry about it. That just translates into one thing, that it's not time to shed your mask, it's not time to decrease your distancing, and there is not time not to clean your hands. So COVID appropriate behavior is the only weapon we have to fight this, whatever variant comes our way.
Right. And vaccinate. And I think you talked very importantly in your statistic also on how there's still being a bit amount of vaccine hesitancy, which brings me to the next question about if you look at why this vaccine hesitancy has sort of crippled, and even in people working in your hospitals, for example, is people wondering if it is actually safe. This is often one of the most Googled things also, by the way, Doc, where they talk about how people are still wondering if it is safe to take it. Do we know enough about the long-term impact of these vaccines? How do you answer these questions?
So, you know, 30 crore people have been vaccinated in India itself. We have not had any major adverse events. People have had headaches, fever, lethargy for a few days. Yes, you will get those kind of symptoms. That also less than 5%. The vaccine hesitancy in that group that I was telling you, that 2,000 who did not take it, 95% of them were young nurses. And they still believe that it will interfere with their fertility.
I see.
So that was the big thing at that time. Now I hope it has disappeared by now, and people now with the ferocity with which the second wave came and infected everybody and killed many more people, I think that hesitancy is going down. But this is like thanks to you guys that you keep the subject alive till we reach a point where we have vaccinated at least 70-80% of our country, and we can depend on herd immunity.
Well, keeping the subject alive, well, we'll continue to do that. We can promise you on that one. Thanks so much for your time, Dr. Trehan, for taking all those questions. That's it on FYI today. See you again tomorrow. Bye-bye.